girls, and welcome to the Fall 2020 semester at Southern. Whether you're a new or returning student, in person, online, or a little of both, we are so happy you're here. During this brief video, we'll talk about the resources and systems we have on campus to help keep you and our community healthy and safe as we reopen the university. It might feel a little different, but that's okay. We're all in this together. We know by now that things can change quickly, so we encourage you to keep checking our reopening website for the most up-to-date information and resources. In the meantime, here's how we can all do our part.
As you know by now, COVID-19 is a new coronavirus that can have serious consequences. It spreads easily from person to person, mainly through coughing, sneezing, and other close contact. The most common symptoms of COVID-19 are fever, cough, and shortness of breath. Other symptoms may include sore throat, runny or stuffy nose, body aches, headache, chills, fatigue, diarrhea, and nausea, and a new loss of smell or taste. One of the most important things you can do to prevent the transmission of COVID-19 is to wear a mask or face covering that completely covers your mouth and nose. This is especially important in case you're an asymptomatic carrier. With this virus, you may not have any symptoms for 2 to 14 days after exposure, and in fact, people are the most infectious 2 to 3 days before symptoms even appear. In addition to covering your mouth and nose, please practice physical distancing, and of course, don't forget to wash your hands frequently with soap and water or hand sanitizer. Clean frequently used surfaces, cough or sneeze into your elbow, and if you're not feeling well, please stay home and seek medical care if needed.
Masks or face coverings are required inside all campus buildings and outdoors when you are unable to maintain 6 feet of physical distancing. Free masks are available for anyone who needs one at multiple locations around campus, including the Adante Student Center Information Desk, Bewley Checkout Desk, and Wintergreen Info Desk. If you see someone who needs a mask, please let them know where they can get a free mask on campus. Masks or face coverings must cover the nose and mouth completely. Bandanas or single-layer neck gaiters are not an effective means of stopping transmission and therefore will not be permitted. If you do not want to wear a mask or face covering, you may only participate in remote learning and online classes. We ask that you maintain 6 feet of physical distancing at all times on campus, whether indoors or outdoors. Residential students should refer to their residence hall contract for further guidance on common areas and living spaces within the residence halls. All faculty and staff share equal responsibility enforcing these rules both in and out of the classroom. Should a student fail to comply and not wear a mask or face covering, or keep it on after receiving a reminder to put it on, they will be referred to the Office of Student Conduct for disciplinary violations. Students who live on campus will continue to receive additional guidance about living in the residence halls and will be allowed to leave campus as they desire for work or any other activity.
Our goal at Student Health Services is to help you stay healthy and well. We are prepared to assist you in maintaining your health while we are faced with the evolving COVID-19 situation. We're available for telephone consultation as well as video conferencing. To schedule an appointment, please call Student Health Services. All registered students are welcome and encouraged to access the medical care available in Student Health Services. We would also like to extend a special invitation to graduate, commuter, and part-time students to take advantage of our services. You don't have to leave campus for healthcare. We are right here at no out-of-pocket cost to you. Whether it's a medication refill, injury, or illness, we're here to help with whatever we can. If you become symptomatic at any time while the Student Health Center is open, you can call to schedule a telehealth appointment. If indicated, an in-person appointment will be scheduled for you for further evaluation.
Who will be tested for COVID? At this time, residential students and athletes are required to have a COVID test before coming to campus. A small percentage of residential students will then be randomly tested each week. Random testing of student athletes will begin mid-semester. COVID-19 testing administered by Griffin Health will be made available on campus for these specific populations. However, if any student has COVID-like symptoms, health services may determine that a test is recommended. In addition, any students who are asked to quarantine after coming in close contact with a confirmed COVID case will also be tested. While out-of-state and international students from hotspot or affected states have to quarantine for 14 days upon arrival in Connecticut, they do not have to get tested at the end of that quarantine. If you are tested off campus and receive a positive test result showing that you have COVID-19, we ask that you share these results with Student Health Services. Many of you may wonder what will happen if there is a case of COVID-19 on campus. We have plans in place if this happens. First, if the person is confirmed to have COVID-19 with a positive test result, we will ask that person to self-isolate until they recover for a minimum of 10 days. We will keep in close touch with that person, checking in daily via a symptom checker and telehealth visits with health services staff. We will also reach out to any member of our community who is in close contact with the infected person. This process is called contact tracing, and the goal of contact tracing is to limit the spread of the virus and react quickly. A close contact is defined as someone who spent 15 minutes or more within 6 feet of a person confirmed to have COVID-19. If you are identified as a close contact, we will ask you to get tested for COVID-19, quarantine for 14 days, and also to complete daily symptom checks. Isolation and quarantine space will be provided on campus for residential students who are not able to return home. Students must be cleared by health services to leave quarantine or isolation. Southern's COVID coordinator will help coordinate quarantine and isolation for students who are asked to do so. The COVID coordinator will work with the Dean of Students to communicate with professors and employers to move to remote learning or to excuse quarantine students from work. And they will make sure that students in isolation or quarantine have the resources and support that they need, including food, special accommodations, technology, or other supports.
We know that this feels hard. If you need mental health support, please contact SCSU Counseling Services. We're here for you on campus and virtually to help you through this difficult time.
We are all in this together. Please do your part to protect your health and the well-being of our community. Our goal is to minimize the spread of COVID-19 on campus. Please follow Southern's policies, signage, and other guidance. This is all in place to protect you and our community. Check in on your friends and be patient and understanding. If you have questions, please don't hesitate to ask for clarification. If you need help, reach out. And finally, be sure to follow our website for the most up-to-date information and guidance, including special information for specific populations. In closing, please remember, wear a mask, observe posted signs, maintain physical distancing, and stay home when you are sick. If we all follow these guidelines, we will be doing our part to keep our community healthy and safe.